South Sudan sits on Africa's third biggest oil reserves, and the United States and other Western backers hailed the country's independence from Sudan 3 years ago as a foreign policy success. At least 10,000 people have been killed and more than 1 million displaced since clashes between rival army factions broke out in December. Foreign investment has collapsed, and the cost of the war has crippled the government's budgets.
For more on this now, we go live to Washington, D.C., where the Voice of America's John Tanza is standing by. He's the co-host of the South Sudan in Focus program. Hello, John. Great to have you join us again on The World Today. So what progress has been made so far concerning the peace talks which began in Addis Ababa just yesterday?
Well, there's nothing coming out of Addis as of now, because what happened on Monday was that the delegates from the government, the rebels, political parties, faith-based groups, civil society groups met, and it was just an opening ceremony. And right after that, the mediators met with delegates from the rebels and the government. So nothing is coming out of Addis as of now.
At a peace deal, what measures would be in place to ensure that it's implemented and not just written on paper?
Well, if there is any peace deal coming out of Addis, it has to be an inclusive peace deal, a peace deal that addresses the root causes of what really made the two parties to start fighting. And it was all about lack of democracy within the ruling SPLM party. So any deal that is coming out of Addis has to take into consideration that there is an open space for other political parties to be part and parcel of the governance system in South Sudan. Otherwise, without that, there will be no peace in the country, because what is happening is a lot of other voices have started speaking out against what they look at as, lack of direction from the ruling party, lack of leadership from the leaders of the ruling party. And so anything that will bring stability in South Sudan has to do with democracy. People have to be given the opportunity to speak out their minds.
Now, finally, if the peace deal is reached, how would it affect the humanitarian catastrophe, which seems almost inevitable based on information made available by the United Nations?
Well, any peace deal that is reached has to give room for security improvement, because as it is now, a lot of humanitarian agencies are not able to reach the people who are affected by this conflict, just because there's a lot of fighting in most of the states that are badly affected. That is Jonglei State, Upper Nile State, Unity State. These are the areas that are hard hit by this looming humanitarian crisis. And so any peace deal has to give a sort of humanitarian corridor for aid agencies to reach the people who are in a dire need of basic needs. Otherwise, if there is a peace deal and the belligerent forces are still fighting each other, and that's not going to help the humanitarian agencies.
Thank you very much. I've been speaking with the Voice of America's John Tanza, and he's the co-host of the South Sudan in Focus program. Now let's take a minute to brief you on the virus that's literally been causing panic in several countries, mostly African, and in the last month. I'm talking about the Ebola virus. There's good news and there's bad news. The good news is officials have confirmed that U.S. aid workers who contracted the Ebola virus in Liberia appear to be improving after receiving an experimental drug. But it's not clear if the ZMapp drug, which has only been tested on monkeys, can be credited with their improvement. Dr. Kent Brantley was flown home for treatment on Saturday, and his colleague Nancy Wright-Ball left Liberia in the early hours of today. Now, the bad news is that as at now, the death toll stands at 887, and the victims were from 4 West African countries.
With healthcare systems in West African nations overrun by the epidemic, governments are scrambling to stop Ebola spiraling out of control. Just yesterday, many health centers in Liberia simply shut down as medical personnel have become too afraid to turn up to work. More than 60 doctors have already died of Ebola, hampering efforts to control the outbreak. The World Health Organization, which warned last week of catastrophic consequences if the disease were not controlled, reported 61 new deaths in the 2 days to August the 1st as the disease continues to spread. Hundreds of troops deployed in Sierra Leone and Liberia yesterday to quarantine communities hit by the Ebola virus as the death toll from the worst ever outbreak reached 887 and a new case reported in Nigeria.
The health workers think that they are not protected. They don't have the requisite materials to use as to protect themselves against the Ebola diseases. So many of the health workers, including physician assistants, nurses, and so forth, are staying home.
But officials are not only battling to come to grips with Ebola spreading, but they're also having to deal with the community's mistrust.
Now we go live to Dakar, where the Voice of America's Anne Look is standing by to brief us on the current Ebola situation. Hello there, Anne. Thank you so much for joining us on The World Today. Now, based on what you've observed, do you think that health and quarantine recommendations have been adhered to in countries that have been affected by the Ebola virus?
Oh, I'm sorry. Could you repeat that? I'm sorry, the audio.
Okay, what I said was that based on what you've observed, do you think that health and quarantine recommendations have not been adhered to in countries that have been affected by the Ebola virus?
Well, I mean, that's the concern. I mean, the concern is whether or not these countries will be able to enforce their quarantine regulations. Sierra Leone is just now deploying their troops to the east to try and begin that quarantine. So we'll see how it goes. I mean, the other question too is it too little too late? You know, has it already spread too far?
It appears as though we've lost connection with Anne. We do apologize. We'll try to reconnect with her, but we're apparently out of time, so I think we should just go to the very last story of the day, which is on the lighter side, actually. Now, if you're not one who takes physical activities seriously, then you're about to feel very uncomfortable because even dogs are going to gyms. Take a look.
The dog business is big business, and if your pup is bored with the dog park, doggy daycare, and their dog spa, there's a new option for your favorite Fido, and that's a doggy gym.
And so we really wanted to be the what's next. We wanted to be the safe, year-round environment where people could bring their dog, work with them, either reinforce training they'd already had, work on new skill development, and really just have fun. So we think it's pretty unique. We haven't seen any other dog gyms that compare in terms of having a gym membership, being able to drop in with your dog whenever you want, and really just come engage with them in a new and different way.
Frolic Dogs, which calls itself a canine sports club, had its grand opening on Thursday, July the 31st in Alexandria, Virginia. Owners Kevin Gilliam, a dog obedience trainer, and his wife Kim say their new 3,000 square foot business is the first of its kind in Washington, D.C. area. And the couple thinks they've hit on the next big thing for the nation's millions of dog owners who are willing to buy their beloved pets everything from fancy food to Halloween costumes.
Now, it's important to stay fit, but let's go back to Dakar. We've been able to reconnect with Anne Look. Now, I hope you can actually hear and see me, Anne. Yes. I'm going to ask you the second question, seeing as we're almost out of time. But what can you tell us about, this new experimental drug which was used to treat those U.S. aid workers that were affected? They're said to be improving. What can you tell us about it?
It's being developed by a small company in the United States. I think there are several research efforts going on looking at treatments and vaccines. From what I understand, Ebola is very difficult to research because it's dangerous, and it's difficult to come up with the funds to develop treatments and vaccines for what are considered rare and isolated illnesses. So as far as I understand it, this treatment, as well as perhaps others in development, haven't been tested on humans, and so ethically aren't really considered suitable for widespread use. I mean, we'll see how that develops, you know, in coming months, but that's what I know for now.
Finally, Anne, I just want to ask you, based on what you've observed, what do you think is the most important step which needs to be taken in order to control the spread of the Ebola virus?
Well, what health authorities tell me, what public health experts tell me repeatedly is that, you know, restricting public gathering, hand washing, all of that is very good, but that it's really education and awareness that's going to turn the tide, that people need to be convinced. You can't change behavior just with police and security forces. You need to go into the communities and teach people about the virus, teach them about the symptoms, teach them why it's so important to go to the clinics when they see symptoms. And that's how you're going to kind of gain the upper hand against the virus.
Well, thank you very much, Anne. You've really shed a lot of light. It's not about causing panic, but about making certain adjustments and making sure that we stay healthy. I've been speaking with Anne Look. She's the VOA's correspondent from Dakar. Well, that's where we have to leave it on The World Today. Thank you so much for watching. I'm Cynthia Are. Up next is Sports News.